Hi, my name is Dori Cohen. I'm an occupational therapist who has been practicing occupational therapy for 10 years. I have a strong passion for working with individuals with neurological conditions, and I hold an MS specialty certification. I currently work at an outpatient facility within a larger hospital in northern New Jersey. I work very closely with the hospital's MS center. They're actually located just upstairs, which is amazing. And I work very closely with my colleagues in physical therapy and speech therapy, as well as social work. I think that this multidisciplinary approach to treatment is extremely beneficial for individuals with MS. I'm a big cheerleader for developing relationships with members of the team and prioritizing that collaboration. So I recently worked with a patient who was newly diagnosed with multiple sclerosis. He was doing really well and reported that he came to the OT initial evaluation primarily because his doctor told him to come. He really acknowledged that he did not believe that he needed OT intervention, but was just there to check off some boxes. So with probing and some specific close-ended questions about his day-to-day function, he revealed that he was an avid guitar player, and he said that that leisure activity had become more challenging for him. He also reported that he was a graphic designer and he was coming home from work really feeling a bit more depleted than he was prior. When I asked him if he thought that that was fatigue, he was dismissive about it. And he said, no, I just think it's due to my new diagnosis. I have some more thoughts, in my mind. So I really think that a big challenge when working with people who are newly diagnosed is that decreased understanding of what MS is. I think that a lot of people blindly look on the internet without really knowing where to look, and they develop a skewed perception of what the disease is, what some of the common symptoms are, and they miss out on a whole lot of the big picture. Um, Additionally, I do think that a lot of people with MS and across the board don't fully understand what occupational therapy is. So many people come to me and say, I really don't know why I'm supposed to be here, or, I know that you work on hands, but my hands are perfect. I'm not really sure why I'm here. So there's a lot of misconceptions. So despite telling me that OT was not warranted, I conducted a thorough evaluation, as I do with all patients that come in through my door. During this initial evaluation, I used a dynamometer and a pinch gauge to check his grip strength and pinch strengths, and all of that was within normal range. I also used the 9-hole peg test to assess his fine motor coordination, and I did notice there that his dominant hand was a little less coordinated than his non-dominant hand, which is not typically the case. So that scored within, below functional range. I tested his sensation, that was within normal ranges, his active range of motion, quality of movement, all of that was normal. So I then used an MS-specific qualitative questionnaire to measure perceived cognitive deficits. That too was normal. And then I did an assessment to look at his fatigue levels, and that was lower than normal range. So at the end of the assessment, I spent a lot of time educating this patient on the findings from the evaluation. He was really shocked to find out that his coordination and his fatigue levels were out of the normal range. He reported he didn't even know that fatigue was a symptom of MS, let alone this cognitive fatigue that he was experiencing. So I worked really hard in the first 2 sessions to build what I call buy-in, and provide educational resources so that he can best understand his new disease, offering validation throughout, as well as other referrals that might be beneficial, like a behavioral health referral. So once he believed in what I could offer, I spent a few sessions setting him up with a fine motor coordination home exercise program that he could do at home. So he did not have to come in for an extended period of time and therefore use more energy. I also had him bring in his guitar and created a modified pick for him to use so that it was easier for him to grasp. And we modified the positioning to protect his joints and allow him to play for longer periods of time. I also educated him on fatigue management strategies, and we created an individualized energy conservation technique program to maximize his energy throughout the day and the week. So I think that there are a few essential things that go into making therapy successful. I think that education is crucial, but I also believe that meeting a person where they are in their emotional processing of the disease is equally important. Throughout my work with this patient, I maintain positivity. I encourage development of self-efficacy during the few sessions that we had together. I also made sure to make this program short while also reassuring him that my door is always open in the future should he need. And recently, he actually just sent me a video, which was months later, of him playing at a music venue, and he was still using the pick that we had made together. So obviously, a big win, which was very, very positive to see. So, individuals with MS may experience challenges to participation and performance in their functional activities. Some people are impacted physically. This can include having issues with balance, range of motion, quality of movement, weakness, decreased coordination, and more. Some people with MS have cognitive changes, specifically difficulty with attention, working memory, problem solving skills, executive functioning skills. Some people with MS have visual deficits. This can include difficulty with ocular motor, coordination, eye teaming skills, ability to use their two eyes together, difficulty reading. Additionally, it's suggested that 75% or more of patients with MS experience fatigue, and this can impact performance in daily activities. Additionally, it's important to note that due to the nature of the disease, symptoms may fluctuate from day to day and even from hour to hour. So all of this must be taken into account when working with this population. So I really make sure that I'm asking my patients at each and every session how they're doing that day, what they did prior, and sort of taking that all into account. In occupational therapy, we utilize both restorative interventions as well as compensatory interventions to help promote function. So if a person is having difficulty shaving or putting on their socks and shoes, for example, we may address working on improving their active range of motion, their arm strength, their fine motor coordination, their balance. We might also work on developing an individualized fatigue management protocol to help them be able to carry out that desired task. From a compensatory approach, we might work on exploring the environment in which they're doing the activity, their positioning. So we might look at whether they're doing it from a wheelchair versus the edge of the bed, standing versus sitting, using a shower chair, using a stool without a back. So all of this certainly can impact function. I'm also looking at home accessibility, adaptive equipment such as reachers, modified razors, dressing sticks, sock aids, and more. So we work on modifying the technique in which a person carries out the task. OTs consider ourselves creators, and so we really do use creativity to develop a unique solution to various problems, both from what exists out there and definitely making our own supplies along the way. So, some effective strategies that I use when working with a person to develop a specific goal. As I mentioned prior, I do think that it's really important that people have buy-in when participating in OT. So, I have had many people come to occupational therapy who are quite reluctant about it. Many who have never heard of occupational therapy before, they report, I'm really not sure why I'm here. So I really strive to prioritize education about the purpose of occupational therapy, the scope of practice, the purpose of each and every activity that we do. Oftentimes it looks like we're just playing with toys or games, but really there's always a purpose behind every intervention that I choose. When possible, I also try to provide educational resources so that patients can really understand their diagnosis, their symptoms, and what to expect within rehabilitation. In occupational therapy, we also strive to create a client-centered approach to therapy. Based on presentation on their initial evaluation and goals for rehabilitation, we work together to create functional goals. So somebody who might say, I want to work on my memory, I probe further and we work together to explore what they want to be able to remember better. So we might end up working on memory as it relates to things like appointment management or medication management. So always tying that functional component to the goals. And then even within sessions, I find that using meaningful activities is a lot more motivating for people than using generic interventions and treatment tools. So I recently worked on compensatory memory strategies with a person who's an avid sports fan. And instead of just remembering something random, like how many cones are in the gym, I decided to use his passion in the session, and I had him learn players of the opposing team, their first and their last names, as well as the numbers on their jerseys. And this was really motivating for him, and it got him going, and he was actually quite successful, which was really cool to see. And with a person who used to like to cook, I created a whole simulated cooking situation where we used bean bags and a spatula to simulate flipping hamburgers. This activity worked on balance and safety awareness, gross motor coordination, visual skills, processing skills, and endurance. So patients have more fun this way, and inevitably they try harder, which is what I'm hoping that I'm able to achieve with them. Additionally, research supports that there's a strong connection between increased self-efficacy and performance in MS treatment. I prioritize use of strategies for self-reflection, performance of just right challenges, and really a celebration for any and all progress that happens within rehab. When asked how I help patients with MS remain focused and positive while working to achieve a goal, I really do think that this is a tough one to answer, and it likely looks different depending on who I'm working with. Because everybody really is so different. But in general, as mentioned previously, I like to create a just right challenge. I strive to implement interventions that are medium level. So not too easy that it's not beneficial, not too hard that they never want to come back again, but something that is just right to help them meet them where they are at that moment. And then over time, I increase the demands of that just right challenge as they grow. As noted before, I also think that it is essential for people to be reminded frequently why they are coming to OT. By working on these specific functional goals and seeing progress, even when they're small in nature, I think that people tend to be motivated. So I really circle it back often, usually every session. It's important to identify barriers to progress and participation in home program. So if the barrier to compliance with a home exercise program is decreased cognition, which happens often, we work on using external tools to improve recall, like an activity chart or a memory notebook. If the barrier to compliance is not having a table to perform the task, which also happens quite often, we work together on problem-solving skills of alternative places where they can perform the activity, maybe different ways that they can work on the same muscle group, and so forth. Additionally, I check in regularly with patients to see what they're doing, which helps hold them accountable. So each and every time I see them, I'm asking them how their homework was. And with people with cognitive deficits, I have them write it down so we both can be held accountable, and we check every session. Lastly, I make therapy fun. It's really important for me to connect with each person on a personal and deeper level. I always ask about leisure and hobbies and family life. While working on physical or cognitive limitations, I incorporate activities that may be fun for a person, and I meet them where they are. I recently worked with a patient who came to her session feeling really down and sad about their diagnosis and some family stuff that was going on that day. So I had this master plan that I was hoping to execute, but I pivoted from my original plan and I decided to work on a vision board with this patient. And this included flipping through a magazine, ripping out pictures that were uplifting to the person. I kept saying, what makes you happy? Rip out things that make you happy. They worked on cutting them out and organizing them on a paper on a vertical surface. So we were still working on my original goal of improving fine motor coordination, functional reaching, endurance, but they were also simultaneously engaging in an activity that was fun and light and relaxing and uplifting. I want people to take away that occupational therapy is an evidence-based profession that's grounded in research. When working with the neurological population, occupational therapy therapists incorporate both restorative as well as compensatory approaches to maximize function. We may use interventions to promote improved upper extremity strength, coordination. We may use interventions to compensate for increased fall risk, like home modifications, explorations of adaptive devices and positional changes. We may compensate for cognitive deficits and work towards making a person's brain as sharp as possible. The overarching goal of occupational therapy when working with individuals with MS is to help people live as independently as possible and to improve quality of life. So even if people are not sure whether occupational therapy is going to be beneficial, it does not hurt to try and to refer just to see, because whether or not it might be helpful in that moment in time, it could be helpful down the line.